Laura and TV, your question is regarding what I have also read in the papers about certain MPs turning positive. You want to know how many there are and how many are critical. And your second question was, indeed, if some of these individuals contracted the disease from the public gatherings, what is the level of accountability? I think these are loaded questions, and I may not be able to provide you the answers because there are agencies that are responsible for following up on those who might break the regulations that have been put in place. But of course, a link has also to be established that there is a process that led to the spread of the disease. I think you are referring to the case of the first few cases in Kilifi, and we know the index case and the number of people who are infected through that individual. I actually do not have that information as to the number of MPs and how many they are, what their state is, clinical state may be, but Dr. Kuria might be able to respond to that if he does have the answer. Otherwise, he may not have that. We can, if we don't have the answers to that, we will try to get those answers and get them to you at some point, okay? Chemtai Goin, Citizen TV, is a follow-up on the question from Helen. I think you wanted to know, indeed, if this is the case, what is the level of contact tracing that will be carried out, and how will that be carried out, given that some of these affected persons may be people who are in public gatherings, have been seen in public gatherings before. I want to say to that question that the protocol for positive cases, once they are identified, is to do the follow-up contact tracing, and that is done for any individual who turns out positive, regardless of his station in society. I think the last time we told you, we talked about COVID cases in different places, and we reiterated again that that is the procedure. We must follow the contacts, and we must trace them, we must treat them, we must isolate them. That process will continue. So in terms of contact tracing, we have set protocols which we always follow, and we shall follow those regardless of who is the person who is affected by this. Nancy Okwaro, KBC. Swala yako ilikuwa kwamba tangu wakati ile tumeondoa zile restrictions kutoka Mombasa County na Kilifi County, Eastleigh, Old Town, mambo yako namna gani, si ndio? Well, unajua kila siku tukisimama hapa tunaongea na Wakenya, tuambia Wakenya ya kwamba ni muhimu sana tufate zile sharti zimewekwa. Hizo sharti ndio ni kinga yetu na lazima tuifuate. Kwa hivyo hiyo itategemea vile watu wanajichukua wenyewe, ile responsibility ya jukumu ambapo wanachukua kujikinga na kukinga wengine. Na yetu ni kusema kuambia Wakenya, tafadhali tuendelee kufuata zile sharti ambapo zimewekwa na Wizara ya Afya ili tuweze kujikinge na tukinge wengine pia. Na tukiangalia zile manamba ambapo tunapata kutoka testing, tunafikiri bado mambo iko under control.